Thank you, Amar, for a wonderful presentation. We have a last presenter. He's Abdul Qudoos Memon from Bilawal Medical College, and he will present his work on assessment of patient satisfaction with the treatment of hepatitis C infection at District Headquarter Hospital, Kotri.
First of all, Assalamu alaikum to all respected chairmen and fellow colleagues and faculty members. My name is Abdul Qudoos and I am presenting, and our research title is Assessment of the Patient Satisfaction with the Treatment of Hep C Infection at DHQ Hospital, Kotri, Pakistan. I would like to thank my fellow colleagues Dr. Usama Narejo and Mohammad Shoaib Ibrahim for their collaboration during the whole study. Hep C is a major public health challenge in Pakistan, and our country has the highest burden of the chronic Hep C cases with increased morbidity and mortality. The introduction of direct-acting antivirals has improved treatment outcomes and also management by offering high cure rates with decreased side effects in contrast to interferon-based regimes. Patient satisfaction is also important because it is a key indicator of quality of the care and treatment success. The objective of the whole study is to evaluate the level of patient satisfaction with Hep C treatment at DHQ Hospital, Kotri, and identify the factors influencing the satisfaction. Methodology. This was a descriptive cross-sectional study conducted between the January to May 2025. Total 150 patients were observed who have completed their antiviral therapy. The sampling we used was the convenience sampling, and data was collected by using validated patient satisfaction questionnaire with the 5 key domains: access to care, physician, communication, drug availability, counseling, and side effect management. The data was analyzed by using the SPSS version 26. Now let's come to the demographics. Out of 150 patients, 58% were males and 42% were females, residing 66% rural population and 34% urban population, with a mean age of 41.2 years with a standard deviation of 11.8 years. All the patients' age was ranging from 22 to 68 years. It means that all of them were of middle age. Out of 150 patients, 78% were satisfied with the whole treatment experience. Breaking the domain down by domains, the doctor-patient interaction scored the highest with 85%, medication access 81%, counseling and education 72%, follow-up and lab facilities 62%. Not the whole study was perfect, but there were certain dissatisfaction. About 22% were dissatisfied because of the delay in the lab facilities and follow-up care. Now let's come to results. We also examined the association between the treatment and clinical outcomes. The 2 key associations were treatment adherence and satisfaction with a p-value of 0.003 and sustained viral response achievement and satisfaction with a p-value of 0.001. Now let's come to discussion. All of our patients were highly satisfied with the treatment services at the DHQ Hospital, Kotri, with the strongest domain, physician, patient communication, and drug availability. The challenges we faced during the whole study was delays in the lab services and counseling gaps. All of our findings align with international evidence on the patient-centered care. To be concluded, Hep C treatment satisfaction is high at DHQ Hospital, Kotri. Our recommendations are to improve the lab service efficiency, strengthening counseling and follow-up care, enhance patient-centered communication. We also faced certain limitations that it was a single-center study and with a convenience sampling which limited generalizability and objective treatment outcomes. And our future directions are that it must be the multi-center studies and also the qualitative interviews with the patient so that we also have their perspective. In the last, I would like to acknowledge the DHQ Hospital Kotri staff and patients for their for all collaboration. Now, thank you for your attention. I will be answering any queries.
That was a very engaging presentation. We'll quickly move to our question and answer session. If any of the students want to ask any questions from our presenters, any questions?
The more questions should be from the student side, because the whole event is being arranged for you people. So you should take an active part in question and answer session. And every question is welcome over here. Come on.
Do we have any questions from the students? It is an interactive session and we expect you to participate.